I came here to Thorncliffe Park to get my booster shot. I booked it about a week ago when eligibility was reduced to 50 years of age through the booking system, and this is one that came up. And I'm joining a number of other people in getting my booster shot, and of course we've been hard at work as a city trying to increase our capacity at the fastest pace that we possibly can, and we have increased it already in the days since the province changed the eligibility to include people 18 plus from about 400,000 doses per month for the booster shot to now 1.2 million shots per month. And I'm pleased to say that already, as a city, we have put into people's arms 457,000 third doses. 457,000 booster shots have been administered to people in the City of Toronto, and of course that number is going to go up every day as all of our healthcare partners, because we have a network consisting of people who are operating the 5 city-run clinics, a large number of clinics run by hospitals and other healthcare organizations, 450 heading towards 500, hopefully, pharmacies, and doctors' offices, and all of those combined together to make up Team Toronto. And as I say, we're well along as a city at 457,000 third doses, booster shots administered, and 184,000 third doses have been delivered by Team Toronto in the last 7 days. And so that's a number we continue to work on. That's a number that will, of course, again, have a daily total, and we will keep people informed of that. It's important, of course, that people should get the third dose as soon as they can, and to continue to find ways through the City of Toronto.ca website or otherwise through the healthcare websites operated by some of the hospitals and healthcare organizations, because there are appointments being added. There were appointments added, for example, today, thousands of appointments to reflect the fact that we have canvassed the hardworking staff from Toronto Public Health and from the other organizations and confirmed that they will work on Christmas Day, on Boxing Day, and on the day after. There will be clinics open on those days, and of course appointments will be made available for those days for people to take advantage of, so that we can continue to ramp up our capacity. I will just say that the city government is doing everything that it possibly can to ramp that capacity up, to expand that capacity, and we will continue to work at that. And so if people can stay in touch and check on the availability of appointments through our own website, toronto.ca, but also through some of the hospital and healthcare websites, and through the pharmacies who maintain waiting lists and have vaccine supplies. I should also say that it is equally important for people to, as we've mentioned many times, but it bears repeating, please follow the public health guidelines that are in place, not just the restrictions, but also the common sense requirements that they've talked about from the beginning: washing hands, wearing a mask, and please be careful about how you're socializing. I would suggest everybody take a look at their own plans for the holidays and examine each event that you are planning, even a family event, and sort of say, well, how big is it? Is it bigger than it should be? Is it bigger? Does it have people included in it that might be more vulnerable in terms of their age or their health situation? And please take account of that, and err on the side of caution, just because I think that's something that's going to help us to get through this holiday period, and help us, frankly, to get through the Omicron period generally, is to be cautious and to be careful and to get vaccinated and follow all of the guidelines and just use an extra measure of caution. I've often put it this way, that last year we were restricted to having Christmas dinner for 2, basically, in many cases. Certainly that was true of us. And this year, please don't go to the sort of full-blown family reunion, because it's not time for that yet. There will come a time, but this is not that time, and rather it's better for people to examine each and every one of these events, split them. In our family, we're going to have a number of different events, whereas we might have had one larger one. We're going to have smaller events with individual families, and that's a way to, again, make sure that you're keeping the number of people down that are exposed to each other, and that you're trying to be safe. And please think about wearing your mask as often as you can. Please think about avoiding crowd scenes. There aren't as many crowd scenes because of some of the capacity restrictions put on. I go into the rest of this week and through the holiday period with a great sense of hope, because we're working hard to expand the capacity for the booster shots. People are responding and wanting to get their booster shots. People are keeping a little more to themselves and watching what they're doing. I hate to hear this said, but there are events that are actually being canceled, which I think is a sign that people are thinking carefully about whether they really need to do something now, or whether they could do it just as well, say, in the new year when things are a bit better. And so again, I conclude by thanking people for their cooperation. People have been patient, they've been cooperative, they have been wanting to do the right thing and actually stepping up and doing the right thing. I should tell you, by the way, we also have just approaching now 40% of all kids in the City of Toronto vaccinated. That's about 82,000 kids, and that's again a remarkable achievement for us in terms of both the availability of those doses for kids, but also the willingness of families to step up and get their kids vaccinated. And of course, 40% done means 60% to go, but we will keep working at that as well.
Mayor Tory, you talked about things being canceled. What about the New Year's Eve celebration? Has that been talked about?
We have asked Dr. de Villa for her advice on that. As people might know, we had planned a kind of dispersed fireworks event and deliberately done it that way in Etobicoke, the central waterfront, and out in Scarborough, so that we would not attract one large crowd in any one place, and that meant we were not going to do something traditional at Nathan Phillips Square. I'm awaiting Dr. de Villa's advice, and we're meeting every morning with her and with the other members of our emergency management team for the pandemic, and I would expect we'll have some news on New Year's Eve in the next day or so. But part of the reason as well that we were doing high altitude fireworks, not just ordinary fireworks, was so that people could see it from many different parts of the city and wouldn't feel they had to go down to the waterfront to see the fireworks. So we'll have news on that in the next day or two, but again, we're going to be guided largely by what the public health people, including in particular Dr. de Villa, have to say to us about that.
Thank you. Thank you very much.
Thanks. Thank you.